Neurofeedback is a new therapy for the treatment of neuropsychological disorders such as ADHD. This treatment is used by psychologists, psychotherapists, and occupational therapists. In contrast to psychotropic medication, neurofeedback offers long-term and sustainable treatment of symptoms without any secondary effects. The THERA PRAX system from NeuroCon consists of a mobile PC with a monitor for the therapists and a second monitor for the patient, the software for neurofeedback and signal analysis, a DC EEG amplifier, as well as a keyboard and a mouse. The brain generates voltage differences with an amplitude of a few microvolts. These voltage differences are measured by electrodes attached to the patient's head. With this procedure, it is therefore possible to monitor brain activity. Small electrical brain signals are strengthened by the amplifier. It only takes a few clicks and the therapist can start a session for their client. One of the most typical brain signatures used in neurofeedback are slow cortical potentials. SCPs are associated with the attentional levels of the brain. They are therefore used in the treatment of ADHD with neurofeedback. External artifacts like eye movements and muscle activity are filtered out by the technology's unique online eye and muscle movement correction. During therapy, the patient controls their brain activity using visual feedback of an object, in this case, a fish. The object rises or falls online depending on the patient's brain activity. At the beginning of a session, the program is set up to move the object in a specific direction. The patient therefore needs to control and train their level of arousal depending on the direction of the arrow. If the patient is able to control their brain activity in the predetermined direction, they are rewarded with a picture of a sun. The patient learns to regulate their brain activity by a learning process called operant conditioning. Patient motivation and therapist feedback plays an important role in this. The therapist's monitor shows activity from the different electrodes as well as the results for each of the training cycles. After a few cycles have been completed, the results from the session are evaluated. In the results, 2 lines can be seen, illustrating SCP training. The blue line represents the cycles in which the patient had to concentrate, while the red line shows the results of the cycles in which the patient had to relax. A successful session is associated with the difference between these 2 states, relaxation and concentration. The results can be saved and printed as a PDF file, serving as a patient report. Normally, between 20 to 40 sessions are needed to see positive and lasting results.